Hello there, I'm Dr. Matthew Andrews. This video is a brief presentation about our residency program that's updated for the incoming graduating class of 2022 from schools of podiatric medicine and also possibly for anybody who is hoping to match with us who is a prior year graduate as well. There's been a couple different updates to our program since the video I made last year for residency recruitment, so I wanted to give like a kind of a brief overview of our program for those who have designated us for interviews that have not had the opportunity to spend any time with us or otherwise would like some more information about our program. So I'm the program director. I've been the program director here for a little over a year and a half, and I was the assistant program director for about 6 years prior. I've got a couple offices in Sterling Heights. I have a small office in Ortonville. I'm an alumni of this program as well. I graduated from this program in 2014. I'm board certified by the American Board of Foot and Ankle Surgery in both foot and rear foot reconstructive ankle surgery. Our other core faculty members, Stacy Miller, who's a private practitioner in Clinton Township. She is an active wound specialist and staffs our wound clinic at the hospital's hyperbaric and wound center. Kristen Patterson is a local doc that works with a group, Hosey and Murphy and Associates. She has offices in both Mount Clemens and also Clinton Township as well. And then Dr. Carl Dunn, who works in Lansing. Dr. Dunn and I are colleagues. We actually finished our residency training at the same time. Dr. Dunn's a fellowship-trained surgeon and does a large volume of surgery, and our residents have the opportunity to spend time with him in his Lansing office as well at their discretion. So about the hospital itself, we are a level 2 trauma center, 288 beds. So we're a moderate to large sized hospital right on the south end of Mount Clemens, Michigan, right on the tip of Mount Clemens and Clinton Township. We have a new emergency room, emergency department, and GME center. This is a new building on the north side of the hospital that was just completed construction about 18 months ago and just opened. So we have a beautiful facility. We've got excellent space for all of our residents and all these activities. We've got conference space, we've got lecture halls, we've got lounges and things like that for residents, basically for quality of life and to facilitate residency training. The hospital itself is a osteopathic teaching facility. We have approximately 120 residents throughout all of our programs, and that's programs in internal medicine, family practice, general surgery, cardiology, orthopedics, urology, and I believe there's another 1 or 2 programs in there as well. So we have a very, very robust graduate medical education department. We have excellent resources, not only through McLaren Health, but also through our alliance with Michigan State University, through the College of Osteopathic Medicine and what's called the statewide campus system. So we've got great support. We have a full-time residency coordinator for our residency program, and then the graduate medical education department sponsors several different wellness activities throughout the year, as well as being a staunch supporter of academics and research. We have this is new for this year, a new outpatient surgery center and medical office building that's under construction directly across the street from the hospital as well. This is a place where I plan on moving a majority of my cases, especially some of these shorter procedures that don't require an inpatient stay or maybe don't require elaborate hardware or anything like that. So we've got more ORs, more capacity, and then really just the facility itself is moving in the right direction. Our program is the oldest continually running program in the country. This began as Civic Hospital, which morphed into the Kern program, and has had a couple different changes of hands over the years and a couple changes of location, but we're currently housed at McLaren, Macomb, where I'm hoping to stay for a very, very long time. We have a very, very diverse alumni network. We've got excellent opportunities for all of our graduating residents, whether they're looking to stay in the area within Southeast Michigan or you're willing to relocate. We've got alumni all over the place, and just in the past 10 years, we've got alumni that are in Texas, California, Delaware, Tennessee, Florida, New York, all over the country. So, and always available to assist with job-seeking opportunities for our graduates. We do have a robust practice management experience. We have a residency clinic that is on Gratiot and 16 Mile or Metro Parkway. Our clinic is fairly decent in volume, and we see a very wide variety of pathology. We see a fair amount of wounds. We see a lot of musculoskeletal complaints. And we get a lot of internal referrals from the other clinics within the building, particularly from the internal medicine clinic and the family practice clinic as well. So we do get a fair amount of practice management experience. And then as residents in the clinic, you're also allowed to practice relatively autonomously. I'm there to support you and to kind of guide, but it's not a clinic where you're looking over my shoulder. It's where I'm looking over yours, if you will. So we do have an excellent opportunity for loosely supervised independent practice in our clinic. We do see above average surgical case volume for a program our size. Like I mentioned before, we do have a large GME support staff, not only for our program, but for the rest of the residency programs as well. And they're very involved with seeking out opportunities for our trainees as well. We do have a fair amount of labs and workshops and things that we do both at the beginning of the academic year and really just throughout the year to help hone our skills outside of an operating room. So with the use of like wet labs and sawbone labs and things like that, those opportunities pop up with a degree of frequency. That's one of the benefits of being in Southeast Michigan is there's several residency programs in the area. So oftentimes we have pretty good resources for residency training. We do regional academic collaboration as well. We're part of the Michigan Podiatric Residency Consortium, where we have workshops and things that we do throughout the year that are targeted for all residents in Southeast Michigan, which include things like logging workshops, labs, practice management seminars, things like that. So these are excellent local resources that we have available to us that are external to the hospital. And then we also are part of Michigan State University, both as part of the statewide campus system, but our residents will also receive an adjunct faculty appointment with Michigan State as well. So it's a great CV builder, particularly if you have any interest in academic medicine. We do have a pretty rigorous academic program. We are an academics first program, and academic requirements do take precedence over things like case coverage and other requirements. So we do have conference twice a week, which is a good mixture. We usually have lectures on Tuesday, and then Thursdays we'll typically have case presentations. We do review a significant amount of imaging, medical imaging. I'm a big supporter of reading all of your own imaging studies, so we try to be have a very robust radiology rounds. We do monthly journal review, and this is where we review an entire serial of a journal with a good in-depth discussion. This usually takes a couple hours, usually like on the third or fourth Monday evening of the month, and this is something that we're all very well prepared for, and this is a pretty significant academic requirement because we read a lot of articles and there's a lot of material that's covered. We do also do a monthly social journal club, which is usually the last Wednesday of the month, and this is typically a sponsored dinner by one of our vendors, where we do review some journal articles as well. We have a residency-sponsored McLaren review. We have a large library that has a lot of physical texts and periodicals, but also PDFs of several of the textbooks that are applicable for our study, and then also access to things like board preparation software like Board Vitals and Board Wizards that our residents are able to utilize the library subscriptions they don't have to pay out of pocket for. We have a staff of dedicated research support personnel as well. So we have a full-time librarian that assists with literature search, and then we have an IRB liaison who is a research PhD, and then also we have a research coordinator. So there are a lot of research projects that are really turnkey. If you have interest in research in medicine and musculoskeletal medicine or outcomes, especially within podiatry, there's a lot of projects that are really turnkey projects that you can really take the reins on and just kind of run with that are already kind of pre-built for you. Our academic program does highlight what's necessary to pass the ABFAS and ABPM exams. Those are the primary outcome metric of your residency training, is passage of your board exams. So our academic program is largely geared toward that. However, we do a lot of external academics as well that focus more on things like dermatology, oncology, and some other topics that are a little bit more esoteric, if you will. Surgery case coverage, obviously we're at the hospital. We have the new surgery center going up across the street, so the bulk of our cases are done at the hospital. We also cover Premier Surgery Center in Clinton Township and then Insight Surgical Hospital in Warren. This is the former Curran Hospital that still stands and is under new management, so we still have a large podiatry staff there, and we still cover a lot of those cases. We have the opportunities to cover cases in other places as well. The Detroit VA is a place that we've spent a significant amount of time in the past. However, they've had some COVID restrictions over the past year, so our access there has been somewhat limited. However, that door is still open for us should we choose to cover cases down there in the future. And then, of course, other McLaren facilities within our region as well. So who are we looking for? We're looking for, obviously, bright and talented physicians to join our team to be part of our training program. Self-motivation goes a long way. If you are a self-motivated individual and you have a good amount of integrity to know where you're supposed to be and when, you'll probably thrive in this program. Most people that are looking for a residency training program will want to go to some sort of a flashy research institution or somewhere that has a great reputation. And my thing is, from a quality of life standpoint, you probably want to choose a program where you get to wear scrubs all day and get free food. So our ideal candidates is obviously going to be somebody that just fits in well with our group. And my big thing also is that we're looking for people that are going to be comfortable being handed the knife on day one, because that's what's going to happen. We're in a situation where we ended up having no PGY2 residents this year because of our program transition a year and a half ago. And as a result of that, our PGY1 residents are a good ways through their rear foot numbers already. So our PGY1 residents are doing cases like external fixation cases and flat foot correction and things like that are generally reserved for senior residents, or the senior residents will usually cap those cases. But our residents have had very, very good exposure to that, and that's something that I plan to continue. So the capability that you show in academics and in the operating room will really dictate how quickly you're given the knife, and my goal is to really just be there to help guide you doing the procedure. Interviews themselves, this is going to be through Zoom, the Zoom platform. We have our interview matrix largely plotted out already. We do have a couple undesignated folks that we're adding in as well. This is a combination of academic and social interviews. I have a couple academic case scenarios for you. Our residency interviews are relatively low pressure. I'm not looking necessarily to see that like the exact answers I'm looking for. I'd like to see how you think and how you work your way through a problem of low to moderate complexity. That's really just what I'm looking for. I'm trying to get a good idea of how you think and how you are able to process information quickly. And then our residents do the second half of our interview, which is an academic interview where they'll ask you a couple questions, mostly about trying to get to know you kind of thing. Because that's, like I said, our goal is to not only have bright and capable resident staff, but we also want people that are going to get along well with the group. So if you're a good match for us, then you'll likely be ranked pretty high. I do take pride in the fact that our interviews are relatively low pressure as well. So we're not going to make you hand tie anything or try to tap the rhythm to the Macarena while you're answering questions or anything like that. So otherwise, our interviews are going to be the 7th and 8th in the afternoon through Zoom. And if any of those days don't work for you and you do wish to interview us, we can possibly do piecemeal interviews as well, but just go ahead and email our coordinator, Roman, about that. So if you have any questions, please reach out to me. This is my email address. It's my name, matthew.andrews@mclaren.org. Roman is our coordinator if you feel more comfortable emailing him as opposed to me. And then by all means, if you know any of our current residents or if you want to reach out to our residents, you can certainly reach out to them as well, or email Krista, who's our chief resident this year, if you have any questions regarding our program. We did receive our full CPME accreditation this year as well. We had a site review back in March, so our program is nowhere to go but up. We're looking very good right now, and then we're hoping to get some excellent trainees for our next residency class.